Let me start off by saying that this is an amazingly brave event to be holding, and I congratulate really the biohacker community. I mean, we're probably the only live event in the whole of Europe, and it's going on here, and it's fantastic. I normally talk a long time, and I've been told I've got 10 minutes. So it's like a speed dating moment, I think. And like with any good speed dating, I suspect, we are going to ask a simple question, and I need your participation. So who owns your health? I'm going to give you some choices. It's quite easy. Your mum, your doctor, the state, or yourself. Okay, hands up if you think your mum owns your health. Okay, good. The doctor? A lot of people would say the doctor. What about the state? You pay your taxes? No? Hands up if it's yourself. Is that everybody? Okay. Health ownership. Who owns your health? One person. It's fundamental to who we are. This is the most important equation in medicine. N equals 1. That means that if you're on a study, or a study is showing 99% bettering, and you're the 1% that doesn't get a better from that intervention, do you want that intervention? Do you want it? If you're the 1% that doesn't get any benefit, do you want it? You need to say no, I think. Here's something. I'm going to read this to you, and I want you to shout out who you think wrote it, okay? And I've got to do it quick. So here we go. Personalized medicine is a move away from a one-size-fits-all approach to the treatment and care of patients with a particular condition to one which uses new approaches to better manage patients' health and targets therapies to achieve the best outcomes in the management of a patient's disease or predisposition to disease. We are all unique. Our health is determined by our inherent differences combined with our lifestyles and environment. By combining and analyzing information about our genome with other clinical and diagnostic information, patterns can be identified that can help us determine our individual risk of developing disease, detect illness earlier, and determine the most effective interventions to help improve our health, be they medicines, lifestyle choices, or even simple changes in diet. Who wrote it? Somebody give me a name. Who? Gandhi? Could have done. Wasn't. But who recognizes this? Could you yourself have written it? Yes? Is this our medicine of the future? Yes? Yes. Okay. This is who wrote it. The British NHS. It's on their webpage. This is their future. It's our future. It's everyone's future. The future of healthcare is personalized. It's individual. So, we have a business called Nordic Group. We established in 1997, and our mission is to change healthcare. That sounds very grandiose. It sounds very arrogant. But together, we can do it, and we must strive towards it. We need to steer ownership of healthcare back to the user. So, in our world, we've been able to develop a group of companies that look at genetics, and your genes are your infrastructure. So we need to know more about how we ourselves are built. It doesn't matter how your neighbor is built, or the friend down the road, or anyone else. How are you built? That gives us information about how we perform. It then translates into the phenotype. So we need to test everything from methylation to digestion to allergies or whatever. We then have a chain of clinics. Functional medicine clinics, we're going to build 20 across Europe, aiming for all the big European capitals. Why? Because we need to help lobby politicians. We need to lobby the medical fraternity and say, look, we have some tools here that help change health outcomes. And then we are investing in new technologies, and I'll come back to that very briefly in a minute. Here are our DNA life tests. If you have heard the phrase before, I think it's wonderful that Dr. Judith Stern, genes load the gun, but the environment pulls the trigger. We heard that earlier with epigenetic functions. It's true, but our genes are predicting the challenges or the benefits that we're going to get, and getting to know our genes is very helpful. And if you come down to our stand later on, we have a couple of very nice offers to get those suite of tests. Here's our lab. I love Finland. I'm British, but I love Finland. I have my head office in Copenhagen, but I love Finland as well. And Finland has awesome technology. And you Finns should be very proud of what's going on in this field. And I set up this lab in just outside the University of Helsinki. It's absolutely fantastic, and you're very welcome to go along and see it any day. Here's a new test, DNA Smile, looking at our mouths and the genes that impact our health. It's very important because from our oral biome goes into our systemic function. We need to understand those, and that's a very nice new test we developed. DNA Mind, also another interesting area that looks at how the genes impact the way we think, behave, and when we understand that, we can mitigate some of the challenges we may face. You've heard a lot today about the effects of autophagy, the effects of producing stem cells. This guy, Dr. Longo, I'll come up with him here, at the University of Southern California, has done some awesome research, really awesome research showing how fasting, mimicking dieting, as he calls it, can extend life, can reduce symptoms, can eliminate symptoms. You can buy this book if you don't have it. It's on our stand, and I think we're selling it for €10, so go ahead and get it. But what it then does is it reduces IGF-1, TOR, and PKA, and it elevates the nutrient-sensing pathways. And this is all being clinically proven. Here's a quick picture. Stem cells increase dramatically after 3 days of fasting. It's not 2 days, not 1 day, it's 3 days. By days 4 and 5, you're getting many more stem cells in production. It reduces cholesterol, and it reduces inflammation, C-reactive protein, and other things. We as a company are looking to build into the future, and 3 areas we're looking at is antibiotic resistance. If you think COVID's a problem, it is nothing compared to what we're going to face with antibiotic resistance. 15 million deaths per annum are predicted by the year 2050. ThermoCheck is looking to empower women with looking after their breast health much, much earlier than the risk of breast cancer. And it's non-invasive, it's non-painful, and it works from an infrared camera. And Disruptive is looking at implants and how we can measure bodily functions. So we've got a few offers on our stand, 6, 7, and 8. I finish this by saying, healthcare is personal, it's the future. I have 15 seconds. And go on our YouTube channel, Nordic Laboratories. You will find a lot of very interesting discussions going on from world leaders in the field of functional medicine. Thank you for listening. Thank you for participating, and enjoy the rest of the show.